Hello. Thank you for taking the time to watch this brief presentation on nurse mentorships in the emergency department. Over the next few minutes, I'm going to give you a quick overview on what mentorship relationships are, a few of the mutual benefits a mentoring relationship can have on both newly graduated and expert nurses, how mentorship fits into nursing theory, and lastly, how you can be a good mentor or mentee within your own relationships. So let's start by looking at what exactly a nurse mentorship is. A mentorship is a collaborative relationship between a more experienced nurse and a novice nurse. This is where the expert nurse imparts their wisdom and helps the novice nurse to thrive. This is done through role modeling, being approachable, being trustworthy, and working to understand the experience of the new graduate nurse in their transition to practice and being open to a mutual learning relationship. It is important that the expert nurse truly has the novice nurse's best interest at heart and wants them to succeed and overcome their challenges. It is also important that the mentor helps inspire the novice nurse to be a lifelong learner and work hard to enhance their knowledge, skills, and professionalism. Mentorship relationships have been proven to benefit both the mentor and the mentee. These relationships provide the mentee with experiential learning and feedback and help protect the new graduate nurse or mentee from transition shock, which I will explain in a few minutes. Participating in these relationships also reduces the mentee's anxiety and stress and is seen to improve the workplace retention at the 12-month window. Mentorship relationships are also shown to have many benefits for the mentor themselves, such as giving them enhanced leadership skills, giving them an opportunity for professional development, improving their job satisfaction because it gives them a sense of pride in contributing to another nurse's success. It also helps to bridge the generation gap in the team by helping mentors understand what new graduate nurses experience when they transition to practice. I'm just going to touch briefly now on nursing theory and how it addresses the novice nurse's transition to practice, just to help highlight why I believe mentorship is so important within the emergency setting. Fletcher's transition shock theory is a relatively new nursing theory, which highlights how new graduate nurses can go through a spiral of feeling loss, doubt, confusion, and disorientation during their first 18 months of practice. Throughout research, this was experienced by nurses through feelings of being overwhelmed, unsupported, lost, and useless. Going through transition shock makes one feel very disappointed in their professional role, disappointed in themselves, and has made some young nurses say that they just hate nursing. Within critical care environments, stress and anxiety related to transition shock was found to be the highest of any area of nursing because of the unpredictable environments that we work in within emergency and other critical care areas. It is important for new graduate nurses to understand that almost all new graduate nurses in these studies struggled with workload, assessments, and being able to predict patient outcomes. So if they are having these feelings, they are definitely not alone. Most new grad nurses were found to hide their feelings of inadequacy by focusing on tasks to help them feel more proficient. The truth is, though, that many are just afraid of their own incompetency. As you can imagine, transition shock is found to have a profound impact on retention, with critical care areas having the highest turnover rates and up to 60% in critical care areas leaving within their first year of nursing. Areas with lower retention rates are also found to have poorer patient outcomes and higher patient mortality rates. Mentorship has been proven in research to increase retention rates in critical care areas by up to 30% within the first 12 months. Just a little bit more nursing theory here for you and a quick recap for everyone on Benner's model of novice to expert. And then I assure you, I'm going to bring it all together for you to understand how this all relates to mentorships. So, as you would probably recall from nursing school, nurses enter practice as a novice beginner. As you can see here, the process of becoming an expert nurse takes 5 years or more. Now, just to highlight some traits of an expert nurse would be that they recognize patient deterioration quickly, they identify when the expected progression of events does not occur, and the biggest difference between a proficient nurse and an expert nurse is that expert nurses provide frequent consultation to novice nurses. It is important to know, though, that just because someone has nursed for 5 or more years, it does not make them an expert nurse according to Benner's model. So why all the nursing theory? Well, today's new graduate nurses have been found to rely heavily on technology and scientific database to inform their practice, more so than any other generation of nurses. But technology alone has proven to be inadequate in helping new graduate nurses move forward in Benner's model of novice to expert. Expert nurses remain the primary source of transition support for new graduate nurses. Nurse mentorship is part of the very core of our profession, going right back to Florence Nightingale, writing letters to inspire her nursing mentees and encouraging them to lead with passion. Without adequate mentorship, novice nurses have not shown to progress through Benner's model. They are at a high risk of going from job to job and remaining perpetual beginners for their career, never making that key transition to an expert nurse. So now that you know a little bit about mentorships, some people might ask, how do I be a good mentor? It starts with taking time to find out the mentee's goals and really helping them strive to reach those goals. Take pride in their accomplishments. Help them inspire a spirit of inquiry. If they ask you what they should do in a situation, don't tell them the answer. Help them problem solve and develop those critical thinking skills. Maybe start by asking, why don't you tell me what you were thinking of doing? They do know a lot. They just don't have confidence in themselves. Help give them lots of feedback. Go out of your way to share experience and knowledge. Maybe you were doing a cardioversion or some sort of other procedure. Bring them in and let them be a participant. Be a friend. Reach out and find out how their day or week was. Was there something that was really great? Was there something they struggled with? Be a safe place for them to say that they're scared and to know that it's okay to be scared. Do something nice for them. Take them for a coffee. Leave something special in their cubby. Take a lunch break together. Go sit outside. Have some one-on-one time. However you two decide you're going to establish your relationship, just work within those boundaries and try to formulate the relationship as best as you can to support them. As a mentor, you are passing on your nursing knowledge and skill by investing into the future of our profession. This is how you pass the torch to the next generation of nurses. A successful mentorship relationship isn't just dependent on having a good mentor, it's also about being a good mentee. So maybe you're wondering, how do I be a good mentee? Well, number one, be courageous. Be honest with your mentor about your fears. Tell them your learning goals. You are in the driver's seat for the relationship. Be an active learner. You are the only one who can ultimately be responsible for your own learning. Be kind to yourself. Self-care is more than just having some downtime. It's also about letting go of perfectionism and being okay with the fact that you are a learner. Be flexible. Take time to tell yourself that you did a good job with a patient. Ask for feedback, and most importantly, be open to receive it. Remember that your mentor is volunteering their time to help you grow, so respect their time. Recognize your mentor's limitations. They might be absolutely phenomenal, but remember, this is an opportunity for shared learning. It's okay if they don't know the answers. I hope that this presentation has given you a bit more clarity on what kind of culture we are trying to build in the emergency department by starting an ED nurse mentorship program. I would like to conclude with the following thought. We are inheritors of the activities of people who have preceded us and who have devoted themselves to the art and science of nursing through mentorship. I hope you too will consider devoting yourself to the future development of our profession through the mentorship program. We all rise by lifting others. Thank you.